Australia's coronavirus curve continues to flatten, but tough restrictions will remain in place for at least another month. Over in the UK, authorities also say lifting any restrictions early would risk a second peak. In the US, Donald Trump is pressing ahead with his plan to open up America again. So let's take a look at the latest developments. Australia's two major airlines will be subsidised by the federal government to operate a limited domestic service over the next 8 weeks. We'll have more on that in just a moment. The National Cabinet has laid out a 3-point plan before changes to social distancing rules are considered. That's at least 4 weeks away. US President Donald Trump has outlined a strategy to open up America's economy again. Another 5.2 million people have filed for unemployment benefits, taking US jobless claims over a month to 22 million. The British government has extended its lockdown for another 3 weeks. Another 861 people have died in hospitals, taking the toll to close to 14,000. The World Health Organization has made a tentative prediction that cases in Africa could rise to 10 million in 6 months. The world's poorest continent has seen more than 17,000 confirmed cases and about 900 deaths. And as we just outlined, Australia's two major airlines will receive financial support to keep some of their planes in the air. The federal government has announced $165 million to underwrite a range of domestic routes. Political reporter Jade Macmillian joins us now from Parliament House. And Jade, take us through the detail of this announcement.
Well, coronavirus has had an enormous impact on Australia's two major airlines. Virgin in particular has made it very clear that it wants federal government assistance. It had asked for a $1.4 billion loan. The government has not agreed to that, but it has announced $165 million to underwrite a number of domestic routes. So these flights will include all of Australia's capital cities and also a number of regional centres. The Deputy Prime Minister, Michael McCormack, says it will ensure that essential workers who need to travel to various locations around the country can still do so. It will also secure a number of freight routes, and he says it will also mean Australians returning from overseas can get to their home states or their hometowns once they've completed their 2-week quarantine period. Both of the airlines today have welcomed this announcement. Some of these flights will start today, and it will allow the airlines to reinstate some of the staff that they've had to stand down. When it comes to the longer-term future of Virgin, Mr McCormack says that the government wants to see a market-based resolution, but he says the government will be keeping a close eye on the sector over the next 8 weeks while these arrangements are in place, and he's flagged that there could be further assistance if it's needed.
We've kept reviewing and we've kept investing. And of course, after the 8-week period, we'll see how it's been. We'll see the demand. Of course, we'll continue the negotiations with both Qantas and Virgin, as I've done on not just a daily but almost an hourly basis, to make sure that we provide that service.
Jade, we've also heard from Peter Dutton this morning. He's demanding answers from China about its handling of this crisis.
That's right. The Home Affairs Minister Peter Dutton has said today that this crisis will reset the way that the world interacts with China. He has used some pretty strong language to argue that the government in China doesn't have the same level as transparency as other comparable economies. He says that that is a problem. And he says when it comes to China's handling of COVID-19, the families of those people who have lost their lives deserve some answers.
I mean, we've got over 60 Australians who have died. Well, people say that's a low number. Every one of those cases involves a tragedy of somebody very close to you being lost. Hundreds of people obviously very gravely ill as a result in our country. Look at the loss overseas. All of those families would demand answers and transparency, and I don't think it's too much to ask of. It would certainly be demanded of us if Australia was at the epicentre of this virus making its way into society. So I think it is incumbent upon China to answer those questions and to provide the information so that people can have clarity about exactly what happened, because we don't want it to be repeated.
The Home Affairs Minister Peter Dutton there. Now, the Prime Minister Scott Morrison has also been asked about this issue this morning. He says that Australia has a productive relationship with China, but it's a relationship that Australia goes into with its eyes wide open.
Jade Macmillian at Parliament House, thank you. There are 29 new cases of coronavirus in New South Wales, and the figures show a big jump in testing across the state. 5,000 were carried out yesterday. Reporter Lara Hyams joins me now in the studio. Lara, it sounds like a lot of people in New South Wales are getting tested.
They're starting to heed the message, Gemma, but with these figures in New South Wales, today's figures actually stand at an additional 29 new cases. Now, interestingly, yesterday, the jump in that particular figure was actually 11. So we've really seen a double in the number of cases, but that isn't indicative that there is a spread of the virus. As we've heard, there has been an increase in testing. The New South Wales Premier Gladys Berejiklian said that really the target for testing stood at about 4,000, but we have seen that testing regime elevated to about 5,000 tests taking place. Now, obviously, the demand for testing has increased. There has been a very strong message that people should go and get tested if they know that they are mixing with people who are vulnerable or have come into contact with anyone with flu-like symptoms. But on the other side of the coin too, we have also seen the supply of testing increase. We have seen these mobile clinics being rolled out, especially in areas where there have been clusters of the coronavirus outbreak. And it really does seem to be falling into line with some of the federal government objectives too. We know that the federal government is calling for greater testing, greater tracing, and also an increased ability to respond to when there are local outbreaks of coronavirus. Now, when the Prime Minister went on the 7:30 program last night and was asked what exactly would that broader testing regime look like, he intimated, or the language that he used was a random type surveillance testing. But interestingly, a month ago, Brendan Murphy, who was the Chief Medical Officer, actually implied that the sentinel testing, which the Prime Minister also alluded to, was really meaning that testing would take place for anyone with flu-like symptoms. So we're starting to see a real broad approach to that. That message is beginning to get through.
Now, what did the Premier have to say about school management?
Well, there's been a lot of confusion about the issues around schools. Obviously, with various jurisdictions, the states and territories have control of their own schooling system and what the going back to school regime would really look like. What we've heard today, and even in the last 2 days or so, is the Premier has hit a target. She wants the schooling regime to begin to get back on track the third week of term 2. Now, when that was discussed and outlined today, it doesn't mean that all classes will be resuming, going back to normal to the timetable. It was really, she said that the words that she used was going to be a roster system. So a very staggered approach as to what that face-to-face contact would look like. We still don't know who that would be for or for which schools, but there's definitely been a target set for that. Obviously, there's been a big shift in online learning. So whether or not that plays a role in the continuation of getting those children back to school remains to be seen. But that is something that the government is looking to work on, providing more details in the next few weeks, you would imagine.
We are considering options around a rostering system which will have some students go back on a particular day to increase that level of face-to-face, because the alternative is that unfortunately students could face up to a year or longer at home, and we don't think that's appropriate. So we do need to take these initial steps on how we can introduce face-to-face teaching at some level in term 2, and we're having those discussions.
And the Premier also announced upgrades to the health system to deal with COVID-19 and the treatment.
Well, there's been a lot of concern about whether our health system really has the capacity to be able to handle an increase in coronavirus cases. It seems that with more testing and with more cases coming about, we may need to draw on those facilities. She outlined today that the upgrades would be happening to various facilities and also really looking to bridge the gap between people who have been, cleared or been able to be sent home from hospital, but still really need care of experts around them. Obviously, people that do get released will need to be in isolation for some time and require the expertise of some of the medical staff around them. She also mentioned that the Royal North Shore Hospital will now have a new ward for COVID patients and also an expansion in some of the regional areas. So Mudgee being listed there and also Dubbo having increased capacity to deal with some of those COVID-19 cases. So a broadening of the health system is what we've been seeing today.
Lara, thanks for the update. Japan has declared a nationwide state of emergency due to the coronavirus outbreak. Previously, such a declaration had only been in place for Tokyo and 6 other prefectures. Officials have become increasingly concerned with the rapid rate of infections across the country. The move allows local Japanese authorities to urge people to stay inside. There are more than 9,000 infections across the country. Timor Leste has confirmed a significant jump in its number of coronavirus cases. A week ago, Timor Leste had 2 confirmed cases. Now there are 18. Many of those are from a single group of Timorese students who returned from Indonesia at the start of April. The tiny nation has limited facilities to care for anyone who falls seriously ill or test people with symptoms. Those with the virus are in isolation at a local clinic. The British government has extended its nationwide coronavirus lockdown for another 3 weeks. Harsh restrictions have already been in place for almost a month there. Europe correspondent Samantha Hawley has more from London.
Another 861 people died in the past 24 hours, pushing that toll almost up to that 14,000 mark, which is pretty grim, I know. Dominic Raab, who's deputising, of course, for the Prime Minister, who's still recovering from COVID-19, really made it plain that if they were to lift any of these measures now, there's a real risk of a second peak, so that cannot be done for the next 3 weeks. And interestingly, he just wouldn't be drawn on any further date. He just wouldn't say after the 3 weeks, perhaps, schools could go back. We've seen that in Europe. He just wouldn't say. He said it would be irresponsible to put a date on this. Let's hear from Dominic Raab.
Now at both a delicate and a dangerous stage in this pandemic. If we rush to relax the measures that we have in place, we would risk wasting all the sacrifices and all the progress that has been made. And that would risk a quick return to another lockdown with all the threat to life that a second peak of the virus would bring and all the economic damage that a second lockdown would carry.
The WHO has put that as one of their conditions for actually lifting some of these social isolation measures, that you have to be able to trace the people that have it and then trace who they've had contact with. And we've seen that in South Korea, we've seen it in China, and it's working really effectively there. The problem in nations like this one, and in Australia, I assume, is that there's an element of distrust and people don't like to be tracked. You'd need to have at least, I think, around 80% of people in the United Kingdom using this app for it to be effective. That's the estimate of some people. So to get 80% of this population to agree to be tracked might be the difficult thing. But at the same time, if you then told those people that's going to basically set you free if you do it eventually, maybe they'd be convinced. But of course, there's a huge amount of debate over whether or not that's an acceptable way forward. The EU Commission President has said today that she has apologised to Italy. She says that the EU should have done more for Italy during those early days when they were struggling with this virus. But apologies don't mean that much right now, of course, because what we've also seen today is the EU infection rate has passed 1 million. That means that in Europe, there is 50% of the cases of COVID-19. What an incredibly huge pressure across all of those European nations. And your heart goes out to the people of Italy, of course it does, of Spain, and look what's happening now in the United Kingdom.